I'm Barry Wasteglass, the Medical Director of Canadian Cannabis Clinics. My role is to assess patients for medical cannabis. Community physicians generally will refer their patients to me when they think that they might be a good candidate for using medical cannabis to relieve a variety of different symptoms. The cannabis can target certain parts of the body where there's malfunction. Medical cannabis is commonly used for chronic pain, chronic anxiety, PTSD, mental health issues, mood disorders. And then there's a variety of neurological conditions like MS, Parkinson's disease, ALS, and a variety of other disorders as well that can be helped by cannabis. For medical cannabis, there are two requirements. The condition exists for which it would be reasonable for a doctor to prescribe medical cannabis, and that allopathic treatments have been exhausted before using medical cannabis as per Health Canada's regulations. We consider taking a small number of patients who are self-referred. Patients have to provide medical records to support such a diagnosis, and it has to be accompanied by some documentation that conventional treatment for that condition has been tried. We don't provide cannabis, we simply provide a medical assessment service. So the physician will determine the suitability of medical cannabis for a particular client. I want people to understand that the cannabis is there to try and make things right. It's not a be-all and end-all, it's not going to be the only thing you'll ever need for your illness. We want to engage people as a consultant in this discipline and assure that the patients continue with their primary care provider and or the specialists that are monitoring these particular diseases, as opposed to them being referred to us to monitor those illnesses. Because really, we're only providing the one treatment, likely not to be the only treatment they're getting for that condition. The prescription I give to someone is properly called a document. Cannabis doesn't have a drug information number. It's not an approved drug by Health Canada. It's only a botanical for which the courts have determined the doctor should be allowed to prescribe it. And it must contain a recommended amount per day of cannabis to be used by the patient. In this case, the lowest amount of the medicine that works to relieve symptoms or to meet the patient's goals is the correct dose. Once the patient gets their medical document, they then see our cannabis counselor who helps them with any questions they might have about the best way to administer the cannabis, edibles, inhalation treatment using vaporizers and so on, and also to be able to help them decide which licensed commercial producer might have the best products at the best prices for them. The follow-up visits after starting people on cannabis yields a variety of different responses. In all these cases, a tweaking of the prescription sometimes is necessary. Maybe some people need a little more cannabis, others need a different type of cannabis. And keep in mind that the goals that people have when they begin is not only to reduce the symptoms with which they present, but also to reduce the traditional pills that they've been given by their doctors.
Hi, I'm Jonathan Warinsky, Senior Cannabis Counselor for Canvas RX and Canadian Cannabis Clinics. Over the past couple of years, I have directly helped thousands of patients find the right cannabis products for them, get them registered with a licensed producer that has those products, and provide them with ongoing care. I'm going to answer some frequently asked questions that our patients pose to us in our clinics every day. Very common question we get, how much cannabis should I use? And it actually has a really simple answer for everybody. Use as much as you need to address your symptoms. Don't use more. The idea is to start off with as small a dose as possible and to move up incrementally from there until an effective dose is found that begins to meet the patient's therapeutic goals. So despite being prescribed maybe a gram a day, the idea is not to necessarily use a gram a day, it's to use what you need to get the therapeutic goals you're looking for. When you come back to see the doctor, you're going to be discussing those details, and that's where changes may be made or alterations made for the subsequent prescription. So THC and CBD are two of the more than 85 cannabinoids that have been isolated so far. So these are molecules in the cannabis plant that have medicinal value. So THC, or delta-9 tetrahydrocannabinol, the primary cannabinoid that's been studied, is the one that produces the psychoactive effects, the high, the euphoria. Common uses of THC would be for pain, muscle spasm, nausea, vomiting, intraocular pressure. CBD, or cannabidiol, is a potent anti-seizure medication. It has far fewer side effects than most of the anti-seizure medication that's out there, making it even more appealing to those who do suffer from seizure disorders. It is also a neuroprotective molecule, so anywhere when nerve tissue has been damaged, it shows to be beneficial in helping those tissues to restore full function. If people are using THC and CBD, some of them will report the euphoria, which basically is a side effect, as a benefit. It helps with relaxation, it helps the person deal with whatever symptoms are ailing them. CBD and THC are profoundly medicinally effective molecules. They are not the do-all and end-all for everybody, but they can help a lot of people with a lot of different things.
Patients often want higher THC percentages on the prescription. In Ontario, physicians writing a prescription or a document for medical cannabis might choose to put a cap on the recommended amount per day to be used by the patient. The reason for that is if there is to be any adverse effect from the cannabis, it would be associated with a disproportionate amount of THC in the cannabis strain. That means that, like the typical chemotypes of cannabis that are on the street, that kind of a product would be obviously to get high. And in the medical milieu, that's not our focus. It's also a fact that there is no supporting documentation for doing so in the medical literature. So although there are many out there who believe that higher THC means better pain relief, there's scant, if any, evidence whatsoever that that's the case.
So this is an example of a number of methods for preparing cannabis for traveling and appropriate storage methods. Starting out with the original container that the cannabis came in from the licensed producer, this is simply the best container to keep your cannabis in because it has the full prescription details on it, indicating the cannabinoid levels, the THC, the CBD, the variety, whether it's sativa or indica, and how much cannabis is actually in the container. So the full details of the prescription do serve as a legal document to possess and consume cannabis from the producer. This particular type of grinder, we can store unprepared cannabis in the top, smell-proof and waterproof, so that travels very well. Here's another example from a different licensed producer. This has 3 different compartments, and the idea here would be 3 different types of cannabis that you needed to take with you for different medicating needs. A licensed producer is going to be regulated under federal law Currently, that's known as the Access to Cannabis for Medical Purposes Regulation, or the ACMPR, to grow medical cannabis. They also must keep fully compliant with all federal, provincial, and municipal laws and must communicate with police and fire officials about their activities. Licensed producers grow in carefully controlled conditions, following good production practice standards, including health and safety requirements for production, pest control, curing, packaging, labeling, and storing. They must keep a comprehensive record and submit to frequent inspection. Licensed producers test for microbial and chemical contamination as well as THC and CBD levels. Packaged in child-resistant, tamper-resistant, labeled bottles that keep their cannabis or seeds dry and contaminant-free and display all relevant details of your medicine. Licensed producers ship in packaging designed to protect your personal security and the security of your medicine. Packaging is anonymous, sealed, odor-proof, and always shipped with a tracking number. Licensed producers offer a range of services to help you learn, explore, grow, and understand cannabis as a medicine, including email and phone communications, also partnered with clinics and information centers where doctors and counselors can give personal education and guidance. Patients of licensed producers are provided with proof of legal possession and are protected under the law. Law enforcement has a mechanism to confirm each patient's status through the ACMPR. The differences between indica and sativa varieties of cannabis are somewhat subjective, but there are definite differences. As far as the effect on the end user, that's the more subjective aspect of it, but physical characteristics of the plants are very distinctly different, and most users will report different experiences. Starting with the characteristics of the physical plant, indica is going to be a denser plant, hardier, stocky, broad leaves, dense flowers. People will say that an indica gives rise to a full-body relaxation experience, what we might call stoned, more conducive to sleep, so many people will gravitate to an indica later in the day. A sativa is going to naturally develop in the equatorial range around the planet. It's going to grow considerably taller than an indica. It's going to produce a more lanky flower on its stems. The sativa is going to produce more of a cerebral and uplifting experience, excellent for managing daytime symptoms without making you feel particularly sleepy or groggy.
Cannabis seems to work by enhancing our already existing endocannabinoid system. All humans, in fact all mammals and many other animal groups, have an endogenous cannabinoid system whereby we actually produce cannabis-like substances in our body on demand whenever something goes wrong in our body that is in a part of the body where the endocannabinoid system is represented. The endocannabinoid system was only discovered in the 1990s, which is a relatively short time ago, and it has already impacted conventional wisdom in a number of scientific fields. What some of the most brilliant scientists working in this area believe is that the endocannabinoid system is likely to be the master regulator of the balance that keeps us healthy, that helps to heal us, including neurology and the way we believe the brain works, and specifically the plasticity of the brain. So that was the process. Rather than it being a political one, it was really driven by the science.
Should I smoke cannabis or should I use a vaporizer? I'm a patient of the ACMPR myself. and I'll be demonstrating using my own medicine a few things that can help patients get started in using cannabis as medicine. First off, smoking is not going to be recommended because it is a very unhealthy thing to do inherently. If you take plant material and add fire to it and turn it into smoke and ashes, and you inhale that smoke and some of the ashes, that's dreadfully not good for you. Fortunately, there are wonderful devices available today called vaporizers. They come in handheld portable devices, rechargeable, or a desktop that plugs into the wall. And a vaporizer is going to elevate the temperature of cannabis to the point where the cannabinoids boil off or evaporate into a vapor, and the patient inhales that vapor. Vaporizing cannabis has a far lower harm profile than smoking does, far less tar, far fewer carcinogens developed, and it would be preferred and advised over smoking in all instances. Another benefit to using a vaporizer is that it's far more discreet in that the vapor that does come off the device or that is exhaled from the patient using it is far less pungent and aromatic in a closed space than cannabis smoke. We're going to prepare a small amount of our cannabis in our grinder, and we have a cannabis flower here. We're going to put it in the bottom of our grinder, where these teeth match up to the teeth in the bottom, and we can grind up the cannabis flower, and we'll empty it out. We'll see the consistency is a perfect grind to be used in a vaporizer. So here we have the Vapium by Summit. It's an excellent handheld rechargeable portable vaporizer. We hold the on-off button here. So here you can see the blue light is on in the power button, indicating that power is good and the machine is heating up. We can change the temperatures using the up and down arrow buttons here. And once we do select a setting, the device will begin heating up to that pre-selected temperature. We're ready to load the vaporizers. So now we can open the oven. This is a magnetic door on the Vapium Summit. Take a small amount of cannabis and just sort of drop it in. Never fill it right up to the top. Just a sort of loose pack, 3/4 full, and return the lid. The device has begun heating up. We have the green light, which means it's already at temperature, so I can actually begin vaping right now. So edible oils are newer to the Canadian cannabis market. Licensed producers are increasingly selling edible cannabis oil. These are very different from the oils that are produced to smoke or vape. These are to be taken by mouth and swallowed only. Oil products will come with a dosing device like a plastic syringe, so it makes it easier for a patient to measure out the appropriate dose. But people can take the oil directly straight from the syringe and swallow it. It can be mixed into a food, a smoothie, a yogurt. Edible oils have a very specific place in the Canadian market because there are a lot of folks where vaping or smoking cannabis is just not going to be acceptable. Very, very young patients, those who may have compromised cardiovascular systems, COPD, lung cancer, asthma, these people are not going to be inhaling their medicine. So these oils fill that gap really well and enable them to get access to cannabis products that help them. So here we have a cannabis oil extract from one of the licensed producers in Canada. Every licensed producer packages its oils differently. They all have equivalency factors. This 40 ml bottle translates into 5 grams of dried cannabis. This is a 1 ml syringe. So we'll remove the cap and insert the syringe into the bottle and draw up a very small amount of oil. And then I'm actually going to return most of this oil to the bottle while I measure my starting dose. Just that tiny amount in the end of that syringe is a starting dose. Once an effective dose is reached, this can be just squirted directly into the mouth and swallowed. So when using a cannabis oil, it's going to take a couple of hours to come on because of what's called the first pass effect. So we swallow it, it has to pass through the liver and be metabolized before it's all dumped back into the blood system, which is going to have an all-at-once effect. So when you inhale cannabis, the effects come on within a couple of minutes. When you take it by mouth, the effects can take a couple or 3 hours to come on, but then they're going to come on quite rapidly. So many people aren't quite prepared for that. So using an oil, we want to be very conscientious to use the dosing recommendations that come from the licensed producer that made the particular oil, and follow that quite carefully to avoid any adverse side effects by using too much. Common side effects of cannabis use can involve a loss of spatial sensation, time distortion, disruption in short-term and long-term memory. It can affect a person's balance. It can affect a person's ability to think clearly. It can produce a disquieting sense of a high, or the euphoria that can come with use of THC in particular. It can also be habit-forming, which can be problematic for people. It can lead to anxiety disorders in younger and middle-aged people. So there is a wide range of cautions that come along with cannabis use. The common side effects of opiates in particular range from constipation to habituation, addiction, death. It can involve mood destabilization. It can involve reduced respiratory and cardiopulmonary function. There's a wide range of systems in the human body that can be adversely affected by opiate use. So when traveling with your legal cannabis products in Canada, it's advised to keep each product in its original container, because each container has the label right on it. It has your full prescription, full identification. That alone serves as a legal document to possess and consume cannabis from that producer. The producer is also going to issue either a member ID card, or what's called a welcome letter, or the receipt from the purchase of your cannabis. Any one of those documents, in addition to your photo ID, will serve as legal documentation for you to possess and consume cannabis within Canada. As far as traveling by vehicle, I always recommend put the cannabis in the trunk. Keep it locked away from all passengers in the vehicle in the trunk. It's the only way to assure that were you to be pulled over by the police, it makes for a better starting conversation when they know there's cannabis in the car. Many people ask me if they can travel to the United States, in particular the states that have legal cannabis use, whether medicinal or recreational. And the answer is no. Right across the board, you cannot take any legal medical cannabis outside of Canada under any circumstances, even if you're traveling to a jurisdiction in the United States that has legal cannabis laws.
There are barriers to people using medical cannabis. There has been many generations of people hearing about the negatives around cannabis and those who would use it. It's understandable that political, social, ethical, moral biases exist, and that they do create a barrier for the successful use of cannabis. In other jurisdictions where there was a medical cannabis program, as in the United States, the medical cannabis industry expanded. In Colorado's case, it was, I understand, to a multiple of 3. And this is no great surprise to us here. Suddenly, with the thought of it being legal, patients generally have a lot more comfort coming in and talking about cannabis. And I think that probably explains the growth in the industry. According to the Canadian Consortium for the Investigation of Cannabinoids, there are 49 centers, academic centers in Canada alone that are studying cannabis as medicine. And most of those centers are collaborating with other comparable centers in other countries. So internationally, this is an industry that is expanding at a very rapid rate. You can't talk about cannabis in years or even months. It's weekly. There's new data. It's coming out very fast. And there's every reason to believe that this medical cannabis branch of medicine will continue to grow as it has in a number of other jurisdictions. The general response, I'd have to say, is better than any other treatment I've ever offered or guided people to use in the 40 years I was a family doctor. I can't think of any other treatment that had such a successful response.